we ruled out other endocrinopathy اللي هي لانه في normal intelligence. ممتاز كده؟ طيب let us proceed to abnormal puberty. ممتاز. طيب abnormal puberty approach هنا بيعتمد على انه to understand the physiology of normal puberty and then how to assess the puberty and then the deviation is either early or delayed. So you need to know the early causes, right, or diagnosis, how you make the diagnosis or management, right, etiological. في different ways of classification though. طيب let us see. اصلا النورمال physiology انه في central nervous system control طيب on the hypothalamus, and then the hypothalamus has got a control on anterior pituitary. طيب nowadays we see different boys and girls because they have يعني different because pubertal ages. يعني مثلا ممكن تشوف الاثنين ديل هسه this is of Indian background, this Caucasian, this has got some chest development so she's growing, this one is still مع انهم the same height, this is obese and this is slim. كويس. You can see my cursor ولا you cannot see the cursor؟ بأشر عليهم ديل.
Yes, we can see the cursor. Yes.
You see the cursor. خلاص. ف different ethnicities, different body build وكده. عشان كده timing of puberty dependent on genetic background, environmental factors, and the health, general health and build, body build of the patient. في ما أعرف أنا جايبه هنا ولا ما جايبه. في عندنا paper, you can go back to this one in the Sudanese Journal of Pediatrics عن الكيسبeptin. هي something called kispeptin. And this is a hormone, the kispeptin starts from here, from the nervous system, and can be stimulated by different stimuli. And this will trigger or mark the beginning of the puberty. It's a very important hormone for puberty starting in different mammalian in different mammals actually, so the human and also other animals. طيب فارجعوا للنادي كيسبeptin or just Google it, it's my name or the Sudanese Pediatric Journal, you'll find it. The LH is far more important than FSH in marking the puberty. عشان كده early morning testosterone as well. So people measure the early morning testosterone in boys. This indication that this patient is getting pubertal. And the LH is the one that marks the menstrual cycle in girls. So, and FSH is related to the breast development and also to the nutritional function in the boy's testes. So LH is the one which is more important in identifying puberty in boys and girls. And it has some surge like this fluctuation during the day. So this is midnight and in the morning. That's why associated with early morning testosterone. طيب لما نيجي نتكلم عن التنر staging, تنر هو بريتش يعني physician endocrinologist or تنر مارشال في 5 stages of puberty. Each of them will take about 6 months to 1 year. So the puberty to complete will take about 2.5 to 5 years. طيب. And these are looked at from one angle is as secondary sexual characteristics or primary sexual characteristics. The primary are the organs that are dependent on the sex hormones, direct effect by the sex hormones. And the secondary is by the adrenal gland. عشان كده كل secondary sexual characteristics اللي بيشوفها في البويز والجيرلز دي من الادرينال glands, starting from the mood changes and the sweating, the body odor, and the hair, in the axilla, in the pubic area, and the acne, and some contribution to the height as well. However, the breasts, the testes, and the penile, length and size, and the main effect on the bone, gross plate, these are direct effect by the main sex steroids. عشان كده if the main axis is involved at true puberty, you will find breast development and you will find testicular enlargement and so the pubic hair and the axillary hair and the other features are not conclusive of true puberty. Secondary sexual characteristics تبدأ بدري. So in different societies they have different ages. So you cannot say إنه المكتوب في الكتب ده يقول لك 9. طبعا مثلا في أفريقيا في Black American بيبدأ من very early 7.5 or 8. لكن what you study for the sake of the exam, less than 8 years in girls is early, كويس, or early puberty, precocious. Or less than 9 in boys, this is precocious. طيب less than 8 in girls, okay. طبعا ماخذها من societies مختلفة, European societies. برضو you need to refer back to your colleagues in endocrine there to tell you about the Sudanese girls and Sudanese boys. بعدين برضو في limit upper limit إنه if you don't have the signs of puberty, by which age you need to be worried, the delayed puberty ولا لا. Yes? يعني the agreed age is something between 13.5 to 14. طبعا for the period, the patient should have a period by the age of 15. If not having this by 15, it means there is delayed puberty or delayed menarche. She may have some other signs of puberty, but then she had arrested, what we call arrested puberty. So you need to carefully identify the beginning and the end. So you know what is early puberty and what is late puberty. تمام؟ طيب دي صعبة شوية. شوف الأسئلة. Clear. ممتاز. قالوا clear. Good. طيب مين ده هنا؟ طيب. طيب we have I mentioned this development of the breast whatever and menarche, age of menarche whatever. طيب بعدين in boys we have the enlargement of genitalia and breaking of voice, ده كله طبعا adrenal function. In both genders we have the pubic axillary growth spurt. طبعا بس حاجة مهمة أنبه لها, الأكسيلاري hair try to ignore ignore it لأنه it's very أول شيء هو 3 stages only. طبعا في كل البيوبرتي staging هو بيبدأ من 1. It's not starting from 0. يعني التنر staging starts from 1. 1 means 0 يعني nothing. So if I tell you P1, it means there is no pubic hair. B1, it means there is no breast tissue. Okay, so there is no 0. If you say A1, okay, that means no axillary hair. A2 a little bit. A3 is a full. So it's only 3 stages. That's why it's not very useful. Well, it is racial dependent. So the patient can be hairy. So it's not very useful in the staging. The more important is the pubic, which has P1 to P5. Yes? While P1 is nothing, P2 is something around the labia or the scrotum, P3 is reaching the pubis, P4 is getting curlier, and P5 is having the adult shape, triangular shape. So reach the pubis by P3. We're getting curlier, this is 4, a bit more dark and curlier. P5 is a triangular shape. B2 is around the scrotum and the thighs, but not reaching the pubis. Okay? طيب. Sex differences in puberty, المناركي قلنا يعني typically في certain age, وقلنا السبيرماركي بيكون delayed. عشان كده growth spurt delayed in boys, that's why they end up taller. طيب. الانيشال period of growth spurt whatever دي كلها ما حمشي فيها لأنها this is population dependent. ده الكلام اللي أنا قلته قبل إنه normal puberty delayed ولا precocious. الآن ركزوا معي جدا لأنه حنتكلم عن غير definition of precocious وهنا اللي اتكلمت عنه. ده قلت إنه هو depends على البوبوليشن لكن يعني for your exam المكتوب عندكم مثلا في نيلسون وبتاع 8 years و 9 years. 9 years for boys و 8 years for girls. طلع من populations معينة. طيب precocious puberty اللي هي central or true puberty or peripheral. كويس؟ اللي هي generates independent precocious puberty يعني في secretion التستوستيرون or estrogen from the ovaries ولا periphery from a tumor أو incomplete or pseudo puberty. فعندنا true puberty, this is a true one من الأكسس كله, أو peripheral يعني a true مرات بيقولها central أو peripheral اللي هي independent of the gonadotrophin لأنه في negative feedback mechanism. So they are independently secreting the testosterone and the estrogen and suppressing the gonadotrophin اللي هم LH and FSH أو incomplete. طيب the patient is incomplete. incomplete بنسميهم premature thelarchy adrenarchy. It is thought to be إنه في oversensitivity of the tissue كويس to low levels of or normal levels of estrogen أو oversensitivity also in the pubic area to the adrenal hormones. That's why it's called adrenarche or pubarche. Premature menarche is a very rare condition. I have seen once or twice in my experience اللي هو بتحصل مرة بجلطة الجية وبعدين تجيف تاني ما يحصل خالص. Well, it's not well known يعني the pathophysiology of this لكن it's thought to be full activation of the system for a short time and then disappears and then get deactivated again. تمام? So this is the incomplete puberty. Thelarche, adrenarche. طبعا you have to also know انه يعني half or 2/3 ده بيجي في الMCQs كتير. 2/3 of boys have gynecomastia at birth. And one or مرات اسهل بيسهلوها بيقولوا half of the boys have مرات يكتبوا 2/3 half. شوف الليتريتشر عندكم ايش الريفرنس بتاعكم. 2/3 or half of the boys have gynecomastia during puberty. And half of them they have it unilateral. يعني half of the ones who have gynecomastia they have it unilateral not bilateral. So this is common in puberty in boys. تمام؟ طيب. الآن ده اللي أنا قلته true precocious puberty or pseudo. لاحظ إنه المتوقع شنو في true puberty GnRH is high والgonadotropins are high. So gonadotropin releasing hormone is high. Gonadotropins are high and the sex hormones are high. And the axis is like this activated. وهنا لو pseudo there is peripheral secretion of the estrogen or testosterone and therefore giving feedback to the gonadotropin and gonadotropin releasing hormone. So you have the gonadotropins and the gonadotropin releasing hormone suppressed while the estrogen and the sex hormones and the estrogen and testosterone are high. So while the testosterone is high, it's called virilizing, and if the estrogen is high, it's called feminizing type of pseudopuberty. طبعا هنا true puberty can be idiopathic, can be due to cranial radiation, can be tumor, neurological, and can be priming. خلينا priming ده حسي خلينا نتكلم عن دين. انت لو سألوك في اي سؤال في امتحان شوف these golden rules in etiology. اصلا etiological causes etiological cause يعني the etiology of number of illnesses هي شنو؟ واحد إما تكون غير معروفة السبب idiopathic أو تكون physical trauma disturbance of the anatomy by trauma or tumor أو يكون في inflammatory process inflammation or infection. شفت كيف؟ أو يكون في infiltration by tumor. يعني أصلا الأشياء معظمها بتطلع من كده في أي system endocrine or not endocrine. لو سألوك من ideological causes think of these angles. اللي هي شنو؟ اللي هي idiopathic أو anatomical change due to trauma or tumor or whatever or irradiation or can be due to infiltration or inflammation or infection. Priming ده يعني ده حاجة بنعملها مرات لما كنا نعمل dynamic test so we give the patient before puberty 3 days doses of testosterone or estrogen and this will activate the axis temporarily. Forget about it لأنه ما حاجة مهمة لكم. طيب هنجي نتكلم عن حاجة مهمة جدا في السنترال precocious والdelayed puberty. واحد يقول لي الأكثر البريكوشيوس puberty في البويز ولا الجيرلز؟ والأكثر الdelayed puberty في البويز ولا الجيرلز؟ تفضل مين؟ محمد ازاي معنا؟
ايوه they are saying the precocious puberty is more common in girls.
ممتاز.
while delayed puberty in boys.
ممتاز. Excellent. This is the answer. وهي ده عندنا شنو precocious puberty more common in boys in girls كويس it is idiopathic with no cause. والdelayed puberty قبل قلنا ايش؟ the commonest cause of short stature شنو في البويز constitutional delay of growth and puberty صح؟ معناها زي الايديوباثيك هنا. So idiopathic precocious puberty is common in girls. لكن مما تشوف precocious puberty in boys think of brain tumors ولا something affecting the axis. Well, delayed puberty is commonly idiopathic أو constitutional عادية في البويز in 90%. فما تدعوك للقلق إنه هي delayed in puberty. لكن لو شفت delayed puberty in girls المفروض to think of ovarian failure Turner syndrome ولا في حاجة. واضح؟ This is in general لكن طبعا في other causes. So that's why we get central precocious puberty. كويس ده كله ده كلام المهم في النهاية. ده الملخص اللي انا قلته لك ده اللي هو idiopathic اكثر في الفيميلز. They may have other causes like organic CNS disruption, cranial radiation, hypothyroidism. Interestingly في اللي MCQ study hypothyroidism can result in hypo in precocious and in delayed puberty depending على الستيج بتاعه والseverity. Okay. طيب precocious pseudo puberty in females طبعا بعد ما قلنا الكلام اللي قلناه قبل شويه ده كويس central وperipheral كويس ده in general. طبعا انا لما قلت الان CNS disruption ده more common in boys والidiopathic more common in girls. ده في precocious puberty. انا بتكلم الان عن شنو؟ عن precocious not delayed. الان في approach ثاني. الابروتش الثاني للprecocious puberty pseudo or whatever is to find out the hormones causing these changes coming from where. فممكن انت تقول مثلا نمشي لدي اول اللي هي كده coming from the adrenal ولا from the gonad ولا exogenous. الان exogenous في حاجه اسمها environmental disruptors. يعني ممكن يكون البيشنت ده مثلا في بلاستيك باجز معينه ولا في اكل معين كويس. دي كلهم called environmental disruptors containing hormones and affecting the body build of boys or girls. تمام. sex steroids لو جايه الاكسس دي جايه from the adrenal ولا from the gonad بتفرق. الان لو جايه from the adrenal most probably دي congenital adrenal hyperplasia وده more common في الجيرلز كويس او adrenal tumors. ممكن يكونوا feminizing او يكونوا virilizing Cushing syndrome معه كويس. sex steroids from the gonads ممكن تكون ovarian cyst ممكن تكون testicular mass ممكن يكون macular bright syndrome معهم ovarian cyst بيكون عادة not known how it happens although انه عندهم activation يعني overactivation of some hormones لكن they are prone to develop ovarian cysts كويس. وممكن تكون germ tumors germ cell tumors كويس. وممكن تكون في another organ producing testosterone or estrogen. نرجع الآن لديل اللي هو ده تقسيم ايسوسexual ولا heterosexual. يعني لو حصلت في female والتيومر ده أو whatever the cause is causing more advanced puberty in a feminizing way like ovarian tumor, macular bright, exogenous estrogen ده كله so called isosexual or feminizing. لو حصل masculinization opposite gender معناه ممكن يكون ده congenital adrenal hyperplasia, adrenal tumor or ovarian tumor secreting boy hormones. تمام. يعني in general الهيتيروسexual في الغالب بتكون جايه من وين؟ من الادرينال. والايسوسexual جايه من وين؟ من السكس اورجان. the same in boys. isosexual كويس. هنا الايسوسexual from ده في الجيلز طبعا. هنا الايسوسexual from the adrenal gland لانه الادرينال جلاندز فيها ايش؟ فيها androgenic hormones يعني فيها boy hormones او male type hormones اللي هي بتعمل اكني في الجيلز وكده. عشان كده الايسوسexual ممكن تكون جايه من السكس اورجان في البويز ومن الادرينال or heterosexual تكون جايه برضه من الادرينال ولا from exogenous estrogens. anyway التقسيم ده اسهل انك تشوف السكس ستيرويدز ان اكسس جايه من وين؟ من الادرينال ولا من الجونادز ولا from exogenous steroids. ده كله في السودو. طبعا في الترو بيوبرتي هتكون جايه من وين؟ جايه من السكس اورجنز طبعا لان دي ترو بيوبرتي. So you need the family history examination, cutaneous lesions like in macular bright بيكون عندهم كافيولي different from neurofibromatosis, fundal examination if there is any brain tumor suggest of central precocious puberty. You need head, height, weight and mid-parental height with gross velocity bone age, ternary staging كويس. You need the baseline gonadotropins and sex hormones. You need to test the adrenals as well, adrenal androgens. And you may need a dynamic test, gonadotropin releasing hormone test. ده طبعا biochemical. And then you need radiological. Radiological, you look peripherally and centrally. So you look at the MRI, hypothalamic pituitary region, and you look at the pelvic ultrasound عشان تشوف الجونادز وكده. Sometimes you need genetic test as in testotoxicosis and a special gene, and as well as macular bright. And which gene is that? Which gene is the macular bright gene? جيناس جين excellent عايشة ممتاز جيناس جين جيناس 1 يس طيب ايش هذا ما يمشي طيب ممتاز طيب ايش عندنا ثاني So why do you treat patients for precocious puberty؟ لأنه لو جاتهم precocious puberty early this will close their growth plates so their final adult height will be short so you need to prolong to stop the precocious puberty من إنها تحصل عشان ال final adult height يكون acceptable and also sometimes because they are premature in their mind so this can affect their psychology and can give them psychological trauma so these are the purposes of treatment of precocious puberty if it is a pseudo puberty obviously you need to treat the cause whether it is mass or CH or whatever as beside managing the height well and the psychological trauma والتريتمنت بيكون بايش you give gonadotrophin releasing hormone analog it's called lebron GnRH analog ده هيكون زي like the key and the lock بيقفل المكان اللي بيشتغل فيه الجونادوتروفين so there is no activation of gonadotropin LH and FSH will settle down and there is no production of estrogen and testosterone good كده طيب so you give that ما في certain limit of that until you achieve this purposes of good height and also child is mature so you get good collaboration and decision making with the family. Delayed puberty مرات بيقولوا عليها لو centrally hypogonadotrophic hypogonadism لأنه الجونادوتروفينز ما secreted من فوق أو لو كانت peripheral so the hypergonadotrophic hypogonadism لأنه الgonadotropins are not suppressed. Yes? But this is called the other name primary gonadal failure or secondary معناها central. Okay? طيب hypogonadotrophic hypogonadism طبعا usually قلنا delayed puberty معظمها في البويز شنو constitutional لكن ممكن تكون organic لو في hypothyroidism لو في severe malnutrition لو في optic dysplasia لو في trauma radiotherapy في tumor كويس patient neurofibromatosis عنده مثلا optic pathway glioma او عنده hypothalamic hamartoma كويس دي كلها كوز انها تعمل hypogonadotrophic في شنو في البويز او هايبر او early puberty. طيب hypergonadotrophic hypogonadism in girls طبعا ده الكومون في الجيرلز انه يكون peripheral اللي هو تيرنر سندروم او ممكن الاوفيريان فيلير يكون autoimmune of origin او due to chemotherapy in oncology patients or irradiation او ممكن يكون مع الثلاسيميك patients due to iron overload toxic damage او ممكن يكونوا اصلا disorder of sex development اللي هي complete androgen insensitivity syndrome اللي هو ده يكون اصلا patient who doesn't have sensitivity to androgens and his karyotype was genetically male but presented as a female because there is complete insensitivity to androgens. أو patient عنده polycystic ovary syndrome. فدي كلها causes of peripheral type of delayed puberty resulting in hypogonadism due to a peripheral cause for failure of response and there is extra effort from pituitary to override this so hypergonadotrophic hypogonadism. Hypergonadotrophic hypogonadism in boys can result from testicular damage due to in surgery or kidopixia or cryptorchidism or inertia or in some syndromes like Prader-Willi, Lawrence-Moon-Beadle or Noonan, okay, or Klinefelter or gonadal failure with chemotherapy, etc. So it's usually something physical that affects the testis peripherally. But the commonest is to have constitutional denial hypogonadotrophic hypogonadism. But hypergonadotrophic hypogonadism in girls is common. So careful history, anosmia. Why do we ask about anosmia? For Kallman syndrome. Okay, it's one of the causes of delayed puberty, central delayed puberty. Detailed toxology. Okay, both the growth, weight and height, كده. Staging of puberty, general examination, the fundai. So you are looking for central and peripheral causes. And then you do also, like we did with the precocious, you do the hormonal workup, the endocrine, also that including thyroid function, including prolactin, because prolactinoma and hyperprolactinemia is one of the causes of delayed puberty. Okay, and you do the testosterone, estrogen, etc. You do the cortisol because you are testing the adrenal, okay, and the adrenal androgens sometimes. And then you do the dynamic test. You may do dynamic test beside the GnRH test. You may need to do the HCG test, which is HCG is similar in structure to FSH and LH. So they share some group, beta group in the structure, and therefore can induce the same effect on the testes. And this will tell you whether this is functioning testes or not, especially if you have hidden genitalia and disorders of sex development. Karyotype is very important. And then radiological, especially in females, radiological level, you look at the pelvis and the head for the pituitary as well. And you induce it gently by testosterone or oxandrolone. In cases of constitutional delay of growth and puberty, it can also be induced by estrogen, even in boys. But you can do that in girls if it's constitutional delay. But if the axis is affected and it's central problem, then you need to give what we call maintenance hormonal replacement therapy in form of testosterone injections or estrogen, oral or patches or subcutaneous or creams. There are different formulations of this, so I don't need to get into the details. So this is just giving you the same photo earlier of Turner syndrome. They have hypogonadism. What type of hypogonadism? Hypergonadotrophic or hypogonadotrophic? Hypo or hyper? Hyper, very good. Hypergonadotrophic, very good. Hyper, excellent. Type. And and then we have this delayed puberty due to malnutrition, the body built, and this is Crohn's disease. And then we have Noonan syndrome. Also, they do have some sort of delayed puberty. Type. Okay, good. We come to 1:30. It seems we're probably going to finish the talk in the next session. It's like Dr. Muhammad.
Whatever you prefer, Dr. Amir, we have no problem.
Into what's their preference? أنا لأنه شوية هذا lengthy day كان، لكن خلاص أنا ممكن نكمل الثايرويد ونخلي الادرينال and adrenal gland and CH and the bones نخليها في second session. So I start with them وبعدين بشيل الناعم take them into the MCQs. افتكر الثايرويد is important. بعدين شويه heavy نديكم الجروث والديليد والادفانس puberty والثايرويد فيها هايبو هايبر. This is quite enough to absorb for today. لأنها شويه هي شوف انت you need to make up your mind يعني الكويستشنز بتكون كيف يعني شويه الاندوكراين tough subject بالنسبه لهم انا افتكر. I don't know what is their impression. Do you think it's tough or easy? يعني نشوف الإجابة بتاعته. How do you feel guys? tough. أيوة tough. فهو tough أحسن في ناس قالوا easy كويس. لكن tough يعني thinking absolutely. فأنت you need to understand classifications pathophysiological process behind it عشان تبقى لك easy. هو it is not tough لكن شوية complex. إذا أنت فهمت فيزيولوجي كويس الأمور كويس. قال ظريف لكن في الامتحان طف. طبعا انت اذا فهمت يا اروى اذا فهمته كويس في الامتحان ما بكون طف. الان انت لو جابوا لك اسئله اروى I ask you specifically لو جابوا لكم اسئله في الجروث وفي البيوبرتي do you have a plan يعني you can do educated guessing. دي الحاجه اللي انا هكلمكم عنها next time لما نتكلم عن التيبس. يعني انت
دكتور امير before the session ده هم they ask specifically انه
ايوه
they brought some questions about اللي هو extended matching question about a long acting insulin type mainly different brands. I think كان عندهم question
أيوة.
عن الدوغليداك وعن التريستا.
ايوه
واشياء ما هي familiar هم عليها هناك في يعني in our setup.
ممتاز. طيب انا بكمل الثايرويد بعد صلاه المغرب افطر شويه كده الدنيا شويه وبعدين هعمل ايش النكست سيشن نبدا بالديابيتس وبعدين نكمل بالليس فاميليار توبيك اللي هو الادرينال اند ذا بون. كويس كده
تمام.
فالان احنا ادينه كده شويه اصلي يعني we are back at 7 okay 7 o'clock اللي هو هنا عندكم 6 نرجع بنشتغل الثايرويد والنكست سيشن بنشتغل الدايابيتس اللي هو في الخميس الجاي. نبدا بالدايابيتس حتى بعد كده نتكلم عن الادرينال. الدايابيتس نذكر فيه الاشياء دي كلها عن الانسولين والتايبس والاشياء دي يعني سيبريت دايابيتس اند اندوكراينولوجي زي سيبريت سبيشال